And we are recording now, so just know that. If you need any help with unmuting or muting, there's a screen here and there will be another slide in just a moment. If you do wish to receive CMEs or CEUs, we do need you to say your name and where you're from, and you can do that through the chat box, and I'll send out a chat here in a minute so it pops up for you. Another screen for starting your video and your audio. We would really like to see you on audio if possible.
Arrow.
And let's see here.
There's more chairs out there if you want.
Alrighty, continuing on. And I believe it is time for roll call at this point. So if you're out there on audio, let's go ahead and introduce yourself. That would be great. If you wouldn't mind being on camera as well, that would be really cool too. I know not everybody wants to do that. So if anyone's out there on audio, if you could let us know you're there. Otherwise, you can use the chat box. And we have Daisy Rosero. Jacqueline Santa, Rachel Sebastian.
Hi, Rachel. Hi, Catherine.
And I suppose we should just go ahead and go around the room and introduce ourselves.
Okay. My name is Adrienne McConnell, and I'm a quality improvement specialist for the breastfeeding project.
My name is Maya Trujillo. I'm a quality improvement specialist with Envision.
Good morning. My name is Monica Toquinto, and I work with Nuestra Salud.
Good afternoon. My name is Maria Otero, and I am with Nuestra Salud.
I'm Noel Stone, and I'm with Nuestra Salud and UNM Health Sciences, College of Population Health.
Chris Jepson, home visiting nurse with the Firstborn program in Silver City.
Erin Marshall, Executive Director of the New Mexico Breastfeeding Task Force.
And hi, Courtney McKinney. I'm a program manager who oversees this grant.
And thank you everyone for joining us for today's telehealth session. Today's session is funded by the W.K. Kellogg Foundation and is part of a collaborative project to improve breastfeeding support and care in New Mexico. My name is Adrienne McConnell, and I'm the quality improvement coach for this project. And just to let you know, this session and all future sessions will be housed on our website, and you are free to go in and access those sessions at any time, but just please note that if you are not listening to this live, you will not be eligible for the full credit. And we also like to encourage everyone during the presentation, if you do have a question that comes up, to ask those as they come up. Well, we don't have to wait till the end of the session. And now I'd like to introduce today's speaker. Today's speaker is Maria Otero. She is the founder and director of the Hispanic Latino Outreach Programs for Nuestra Salud, which is a community-based organization whose mission is to reduce health disparities affecting Hispanic communities in New Mexico. Maria has been a solid partner of Envision for several years, and she has been working with minority populations in southern and northern New Mexico for the past 23 years. And under her leadership has provided health education and screening and referral services to over 10,000 underserved Spanish-speaking community members annually in New Mexico. She is a trained public health educator and has provided extensive training in several states in the United States. Welcome, Maria.
Thank you. Thank you, everybody. Thank you for the introduction, and also thank you for the opportunity that you're giving us to be here and be able to share with you the community voices of our community members, especially our Spanish-speaking community, but also our Native American communities. Today, we're going to talk about perspectives on breastfeeding in New Mexico among Spanish-speaking Hispanics and Native Americans. It was a partnership between Envision New Mexico through a Kellogg grant that we worked together in understanding a little bit of more what's going on in New Mexico in our communities. Adrian mentioned, our mission of Nuestra Salud is to reduce health disparities affecting Hispanic communities in New Mexico and the nation through research, training, and outreach. I think for us has been important when we found Nuestra Salud, because we often have seen that our voices were not heard when developing programs, and we saw a need that we needed to come together and partner with organizations like UNM and Vision. See this. So the aims or the purpose of this presentation, we wanted to explore the issues surrounding breastfeeding, especially in New Mexico population groups. Focus groups, discussions used to explore knowledge and perception of breastfeeding. We wanted to know a little bit about the utility of peer support and also the health system support, acceptability and interventions among these groups with breastfeeding. We aim to utilize these findings to examine support, examine breastfeeding support among selected these groups. What else? For some reason, this doesn't work there. I don't know if I don't think it's working. Participants, so what we did is that we went around the, in communities, and I'll talk a little bit about what, let's see, can you go back once? Okay, so
there.
Good.
Should be working now. Sorry about that.
So what we did is that we wanted to go in specific population that our partners from Kellogg identified as we needed to know more information. And what we did is that we targeted a convenient sample. We recruited from several locations in Doña Ana County, Bernalillo, and 2 Native American communities. For our English and Spanish language flyers, we provide, we disseminated everywhere in order for us to identify women that were breastfeeding or have breastfed. We work with local, the WIC offices, different community health workers, or community clinics. And also, we also work with the child care offices in Doña Ana County. And we also work with the Native American communities with an individual, which she is our partner. She is a community health representative that help us reach those women. We also provided child care every time we met in these communities. I think I have to do it like very fast. Hard, sorry. So the characteristics of our participants, our goal was, to reach at least 60 women that were currently breastfeeding or they have breastfed before. And we wanted to know, the women needed to be from 18 years old to 45. And I do believe that both groups, the Spanish-speaking Hispanics and Native American communities, the average age was like 30 and 31 years old. So they were very similar to both groups. And
There it is.
I apologize. I don't know if it's me or the
I think we had a
system
blank
here.
slide or
Yeah.
something there. Is that where you need to be?
Do you want me to try? Okay, so are you going to try, Kevin, or do you want me to?
So
You can.
go forward. So what we did is that we scheduled focus groups in Doña Ana County and also in the native in Doña Ana County, Bernalillo County here in Albuquerque, to reach the Spanish-speaking communities. We provided a lunch or supportive for them, but also we wanted to make sure that we had their consent, that they were going to be part of this. Of course, confidentiality was very important, and we emphasized that. We also administer a small little bit of demographic characteristics of our groups. And we also compensated our community members with a $20 gift card to Walmart. And of course, it was different in every community. Some, wanted cash instead of the gift card, so it was different. So we asked them, and the duration or the average was 2.5 hours, like a couple of hours. But in some like the Native American communities, we actually went over like 3 hours. So so the conversation kept going. So next. So what we, like I said, what we did, we administered a survey, and what we had was we had iPads or tablets in order to help them, assist them with the survey. Some of our leaders or assistants in facilitating the focus group help, sometimes read the survey to some of the participants, because either they were not able to read or it was confusing for them, so we had assistants to do that. We also imported all the data from the survey to another additional analysis. And so our survey results for our focus groups, like I said, we had 2 focus groups for the Spanish-speaking communities. So we had 39 Spanish speakers, breastfeeding moms that participated, as you see in the numbers there. And then we also, for our Native American communities, we had like a little bit more, like 42 participants, which it was really good. Our target was 60 women, to be able to talk to 60 women, and we were able to talk to 81 women. So that was really good to be able to hear that. So when we ask about marital status, as you can see, the Native American communities were indicated they have never been married, but they are living with a partner. And with the Spanish-speaking communities, we saw that they were married or also living with a partner. Their educational levels for this, we can see that like for the Native American community group, they had they were high school graduates, but and I guess for both, the majority of everybody had a high school diploma or GED, and some had college a college degree. Okay. Oh, yeah. And then I think this slide here indicates the household income. We saw that we are working with the underserved populations. As you see that almost everybody goes into, both populations are under $10,000 or less. So I think it's important to keep in mind that when we're talking about this and what are the barriers and risk factors, we think about who are women who are breastfeeding moms are, because just in being $10,000 or less, we know that they live under poverty. Here it's indicating for surveys from our survey. It was we're talking about medical insurance. We saw that the majority were with had Medicaid. Some had insurance, but also a lot of the women did not have any kind of health insurance. For our Native American communities, we in our report, of course, we prepare a report for Envision and Kellogg, and we they indicated that everybody was like the Native American had were qualified for Indian health services, so they did have some kind of health care, and they made a little bit higher, but so everybody of the Native American communities had some kind of health care or medical insurance. We also wanted to know a little bit about their immigration, the immigration status, not status, but immigration, how many years have they been here in the United States, but also how do they identify themselves? And the majority identify themselves as Mexican American or Mexican or Chicana, and that's 60%. And 35% consider themselves Hispanic New Mexican. And then we have a small population that they have Spanish descent in South America. For our Native American population, we asked if they were living on the reservation or on tribal land. And we wanted to know if they were there full time, or because a lot of people will live in the reservation or the pueblos, and they also live or have a home in Albuquerque or other areas in the state. And they indicated that 86% live on the reservation. For our Hispanic Spanish-speaking groups, the majority, like 59%, it's almost half, they indicated that the place of birth was Mexico and 41% was in the US. Our surveys from years from immigration, and I think I wanted to just focus here that we are, they were 10 years or more. That means 28% of people being on the United States for 10 years or more. And then we have 12% 6 to 10 years or less. So we know that a lot of these women have been acculturated or assimilated to where they live now. We also wanted to know if they use Spanish media, and this is actually, we asked this question just because we wanted to know if we ever develop a resource guide or any kind of educational material, what is the best way to reach them. And the majority of them were Spanish speakers, and that's how they feel more comfortable in obtaining that information. And that's the same way with listening to Spanish radio. For our Native American population, they also indicated that they speak their native language. So that is interesting, and that is great, I think, because a lot of the Native American population would like to see more native educational materials that are in their language. So we also asked for family support for breastfeeding, and we wanted to know what was their main support for breastfeeding. And they said that family support was the number one factor for that they would like to hear that. And that's for both groups. That's okay. You can go. So like I said, for our focus groups description, so I just want to go into detail here, but like I mentioned before, we had a total of 8 focus groups, and we did this in a very short period of time, but we did it. I feel very, very honored that I had my team, and I didn't introduce them before, but this is No Stone, and then this is Monica Toquinto, and this is like our team. But and then, like I said, 2 groups in Bernalillo County and 2 groups in Doña Ana County, and then we have 4 groups in two different communities with our Native Americans. And it's a small group. We usually had from 6 to 12 people. and they were between the 18 and 45, and everybody was breastfeeding or they breastfed before. So we use qualitative data from discussion analyzed by listening to audio tape sessions. We review everything. We had transcripts, and then we came using the framework of analysis and also the thematic approach, allowing teams to develop from research questions and narrative research participants. Our data analysis participants able to identify different health problems in their community. We wanted to ask them if what were their health problems in their community, and just to have a little bit of more idea of what their health issues are, or they consider their health issues. This is a conversations with them, and they identified cancer, diabetes, arthritis, hypertension, and a lot of the chronic diseases. Both Spanish speaking groups discussed the lack of access to healthcare, and that makes sense because of the lack of they're uninsured, okay, including parental care in their communities, and then also they reported lack of physical activity and healthy diet. With our Native American, they expressed concern regarding cancer, and also because they were very close to Los Alamos National Labs, and I know that it's been a thing before for other chronic conditions. We discuss healthy habits in new moms, including breastfeeding, folic acid. They all identify that all this is important to be able to breastfeed, and they saw that folic acid, prenatal vitamins, everything in exercise was part of what they needed to be doing. All groups discussed many benefits of breastfeeding, including providing the best milk, bonding between mothers and baby, better nutrition, cost, antibodies, and more. And this is a quote from a Native American woman. It says, breastfeeding helps to prevent colds. Babies hardly get sick. So we knew that all the women they believe and they understand that breastfeeding is the best thing to do for their babies. The perception of community support, and this is what they say, that it varied, of course, with Native American and Spanish-speaking groups. Native Americans participants expressed their belief that breastfeeding is important in their communities. They did feel very strongly that they had the community support that they needed in order to be breastfeeding. It was acceptable in their communities. They felt that a lot of times when they were breastfeeding, they will be approached by an older Native American woman and say, "Great job, you're doing good. This is the best thing you're doing for your mom. For your baby, and we're very proud of you." So they felt that they had that support. They also felt support from the WIC office, for example. All the WIC offices in the Native American communities, they felt very supportive by having a wall of breastfeeding moms like in their office, so they feel like, oh, so and so is breastfeeding. That must be well, because that might be great, because they see this person as authority, or they feel like, oh, she's a role model in our community, and they felt that. So the WIC offices had like a lot of support. Their support also was, having the formula in behind a curtain, because that's not something that they see, so that's not an option. So they felt that they do have a lot of support. While Spanish-speaking Hispanics participants expressed that it is important, but they didn't see that support from their community. And especially, like in some areas in Doña Ana County, for example, they said that they will be at a they said we were at Walmart, we were at the superstore, and there's benches around there, and I wanted to breastfeed my baby, so I sat down, and they came and scolded me, and they said there was from another woman, and they said you need to go to the restroom and breastfeed your baby. So they feel shameful. They feel like I'm not. I know that I'm supposed to do this, but I guess I'm being I'm not supposed to do it like this. So they felt, not with a lot of support. These are the key factors that came for both groups about encouraging breastfeeding. Everybody, they see these key factors. For example, family support. They know that having support from family members, like I mentioned before, from other family members, but also from people from their own community, that they have that. They also said that having a supportive partner is very important to be able to continue breastfeeding or even to begin breastfeeding. Having a mother who breastfed, and also general community support in maternal age. So these are key factors, but also with the Spanish-speaking community or women, we saw that family support sometimes, seeing that a lot of the women have been here less than 10 years and they're young because they've been here 10 years, they have left or they've been separated from their birth, from their country or from their families. So they often lose that cultural aspect that it is okay to breastfeed. So, and they don't have their moms here or their grandmothers here to say it's okay for you to breastfeed. And then they go to the store and they hear, what are you doing? Don't do it in public. So that was, even though they feel that they need that, they have lost that. While the Native American communities had that support in many, not just families, but also with their own communities. And Spanish speakers did not have that. Do you want to say anything?
No, I think that.
And then how should breastfeeding be encouraged? Differences in responses to population groups, and I think we already said this, but Native American groups consistently and strongly supported the idea that breastfeeding should be encouraged. They were, like I said, very positive comments about the WEEK program. In the CHRs, the community health representatives, they have role models that they can have that encouragement. They feel repeatedly suggested as a way to be encouraged, and the role of the community members in encouraging and supporting. For Spanish-speaking Hispanic groups, recommended strategies that directly support mothers to educate community about importance is peer-to-peer. They said that having somebody else say it's okay to breastfeed, in-person education. And also they found that not a very good, even though they, in some WIC offices, they were encouraged, they feel discouraged because when they go for their WIC appointment, they usually will ask, are you formula feeding? Instead of like, are you breastfeeding? That should be like the first question that they need to be asking, because they felt, oh, I have an option. So some reservations expressed by Spanish-speaking Hispanics. Let me see. Some Spanish-speaking was concerned for how and how long strongly breastfeeding should be encouraged. They feel pressure to breastfeed sometimes in some communities, and ease of obtaining formula from WIC. I think I mentioned that. I think I was jumping the gun here, like going forward. But I think that was like an inexperience of WIC staff regarding breastfeeding. They had a really strong feeling, strong, feelings about the WIC program, because they said these are not educators or breastfeeding consultants, or it was more like, are you gonna formula feed? Okay, let me just put a video. They'll go out and then they'll come back. So it will be not really like education.
I have a question. Do you think that's because of a language issue, perhaps?
I don't think they stated that it was the language because this they were in Las Cruces and in Doña Ana. I'm trying to remember, but I don't recall, and I don't think it was a language barrier for them.
Does somebody else have a question? No. Move on.
Yes, please. So we also talk about what are some of the barriers when returning to work, and all groups consistently discuss difficulty in returning to work. We're talking about underserved women, underprivileged, people that have a job, because some of the women said not all of us can stay home, so we go to work, but there were some difficulty because their workplace did not offer, they were not baby friendly, and they did not offer a place to pump or feed their babies. Some, it was very, it's discouraging and it's sad, because when we work up here, one of our focus groups here in Bernalillo County was we had participants that work at a child care place. And she will say, I am very, very sad that I'm breastfeeding that I'm feeding breast milk to other babies, that the moms are, can do that. But I cannot breastfeed my own son or daughter, because they don't let me breastfeed, because they don't give us the time and the opportunity to do that. Even though we have 15 minutes, then there's other problems with having to, with my own peers, they start complaining to our boss that I'm taking too many frequent breaks, that I cannot really do that. We have some Native American community participants that they said that they work in a casino, and really the only place that they can pump, for example, will be at a restroom. And that's, some said there's only a restroom, others said, I wish I had a restroom to pump. So it was, like the returning to work was one of the biggest barriers to breastfeeding. And let's see. Okay. So also here, this is a quote from a woman in the focus group for Spanish speaking. My employer does not like for us to waste time pumping. Our employer does not like and doesn't want to pay for us for the time that we are taking for pumping. And actually, this quote is from the child care place that it was. Our Native American woman said, I would like to see a room where it's okay to go pump. I work at the casino and I cannot believe to go feed my baby. I know that there are others currently pregnant and this will help them to nurse and work. Another Spanish-speaking women, I work in a school and they do not let me pump. So this is a lady that works at a cafeteria, in the cafeteria, and their work timing is not proper at that time when she needs to go pump or feed her baby. So we see a lot of discouragement from their own workplaces. So a lot of people, the participants did not know that there is workforce law or a breastfeeding law that will help them. So that's it was surprising to them. And So does anybody have questions so far? Any questions?
I do have a question. So that law that you refer, the state law that protects breastfeeding in the workplace, is 10 years old this year.
Wow.
Right. So I'm just wondering, did any of them ask about that, or did any of them mention that they had sought assistance with compliance with the state law?
They didn't know that there was a law.
Okay.
People did not know there was a law. And after our focus group discussions, they said, well, can you come to our place and tell our bosses and tell them that there's this law? How can we enforce it? So that's one of the recommendations that we saw, but thank you. Is there any questions from the audience?
No, ma'am, so far.
Okay.
I have a comment too, is that it's not just going to the workplace, maybe and letting people know that there's this law, but I also noticed from one of our other meetings that a physician had mentioned that they can write a letter or a note to the workplace to let them know about the law and the desire to breastfeed for the mom. And that I know that that's not something that we talked about in the focus groups, but it might be something we could share with the communities.
And that is, I worked for the WIC program for 5 years before this, and we did have little cards we could give the breastfeeding moms to let them know about the law and that they could show it to their employer too. So I know WIC did try to get that word out to them.
Okay.
To a lot of them.
Okay.
I would say that just knowing the law doesn't necessarily mean you're going to have a workplace that is open and friendly and coworkers that are going to be open and friendly. I don't know that there's ever been a case actually brought to say, okay, demanding that. I mean, fast food restaurants, there's lots of reasons somebody could get fired and they can say that it's for something else.
And I think the Spanish-speaking women, they did emphasize that, but they were afraid of saying, there's a law.
Right.
And because they were afraid of
losing their
jobs, or they were going to cut their hours. And if we go back to the socioeconomic status that they have, we know that they need a job and they don't want to lose their job. So that's, I think it's the whole system, how it is, and it's sad. Yeah. Go ahead.
We do have a question from online. The question is from Catherine, and she's wondering, was the WIC office in Hatch or Las Cruces? Does the law apply to migrant workers or the reservation?
Okay, so I know that the WIC office that they were referring to was in Bernalillo County. So it was here in Albuquerque, in this county. So it was not in Las Cruces. And then, Erin, do you think you can answer that question?
Sure. So there are two different laws. This is Erin. I'm off camera. I'm New Mexico Breastfeeding Task Force, and we do have a law here in New Mexico that is actually stronger than the federal law, but there is a federal law that does require accommodation for breastfeeding mothers in the workplace. So that would apply. The federal law. The federal law would apply to reservations and to all workers, and our state law would apply to all workers in New Mexico, although probably not enforceable on reservations, but it would apply to the migrant workers. And we do have liaisons who will go out and work on migrant workers. That was something that's come up, and we do work with solutions for people who are in all sorts of different settings, in workplace settings, including like field work for different either research or in our farming industries. So
if these are providers who are here on this telehealth session, should they contact the breastfeeding task force if they have questions about interpreting and enforcing the law, or what kind of resources are out there?
Absolutely. We have a team. We have a workplace team that can assist with that. Absolutely.
Did that answer your question, Catherine? Oh, wait.
Yes.
Yeah,
Okay. Thank you.
Thank you. So we also we also ask our participants, how can healthcare providers support breastfeeding? And everybody said that they wanted to hear actually from providers. And when we talk providers, we know nurses and midwives. They were both mentioned in our focus group report and transcripts, but they said that they also wanted to hear from the doctor. They wanted to hear that support from the doctor, not just from the nurse and not just from the midwife, but they also wanted to hear from their providers or doctor. And in our culture, like in the Hispanic Spanish-speaking communities, we know that we see doctors as an authoritative figure. That is important. Even though the nurse is telling me, I see the doctor as a higher level, so I know that if she or he is telling me to breastfeed, oh, I'm gonna listen. So that was very important. They also mentioned that breastfeeding need to be discussed with husbands and partners to help develop support. And I think it's because of they need to be involved. You know, there was a woman that she felt discouraged. She wanted to breastfeed. She was breastfeeding, and her husband will keep saying, "Why are you showing your breast every time? Why is it that every time we go out, that's the time that you want to breastfeed? No, it's not the time, it's the baby's time." So, you know, she hears all the supply and demand. You're supposed to breastfeed supply and demand. When the baby's hungry, you feed the baby. And it's a mixed message. So she wanted to, like, how can we educate our husbands and our men to be able to do that? Native American population did not have that a problem at all. Like I said, I think they felt a lot of support from their communities and their family members. We also saw a lot of inconsistencies in provision of support depending on the hospital and staff. And I know that is a true statement, because not all hospitals are baby-friendly hospitals, and we still have nurses saying, let me give you, here's all your formula, or here's the pacifier, and here's this. So that, that it's, like I said, a mismessage, and we need that. So they agree that they need to hear, but, we have to hear it from the providers and have that support from hospitals. So our conclusion, several share concerns that may limit breastfeeding. For example, lack of support when returning to work, limited support from hospital staff at the time of birth. Hispanic Spanish-speaking women identified the lack of community understanding and importance of breastfeeding as a major barrier. And I think we discussed that on how even for family gatherings, and if they see a woman breastfeeding, they right away will say, do you need to go to the other room to go breastfeed your baby? So they're hearing some good messages from some of our providers, from midwives or nurses. You have the right to breastfeed anywhere, but then the lack of support in their family members, and it can be because they have lost their acculturation in cultural values from before. Let's see. And then in the Doña Ana group, especially concerned that Las Cruces was not a ready to be baby-friendly city. And we know we're trying, right? Mm-hmm. So these are some of the recommendations that came from all the participants. And it is somehow to implement a linguistically and culturally appropriate mass media campaigns designed to reach Spanish-speaking Hispanics and focus on normalizing breastfeeding and removing the stigma associated with breastfeeding. Work with the insurance companies to ensure that the enrollees are familiar with benefits and support, and encourage breastfeeding. And that's probably more for the Native American community. And because I think we only had a very small number of insured women for the Spanish speaking. And also support for our WIC offices in both counties to find innovative ways to encouraging breastfeeding over formula use. And I think that was one of the recommendations is like, can they just like say breastfeeding? Can they just give us one choice instead of asking us, we have a different, we have a formula and there's a choice.
Marie, we have another question online. Okay. Do you have a list of hospitals that are not baby friendly? Doña Ana County is baby friendly.
Do we have that?
So there is a list. We have 29 hospitals with maternity care facilities in New Mexico. Of those, 8 are designated. Well, we actually include Shinle and Navajo, even though they're on the Arizona side. So we have 8 baby-friendly designated hospitals. There is one hospital in Doña Ana County that is currently baby-friendly designated. It was our first non-Indian health services hospital to become baby-friendly. And the other hospital is coming along. They are on the pathway. We expect, and hopefully I can say this, but we expect them to be seeking designation within the next year. So,
and I know they're working on it.
They are. We've been supporting them, and they are getting close.
Okay, and the reply was, I live in Doña Ana and was able to breastfeed. Great.
That's great.
Yep.
But I just want to make a comment, like, it's one thing to have baby-friendly hospitals. It's part of having a baby-friendly community.
Mm-hmm.
There's a lot more to that. And I think, I know these focus groups, and the project was more, wasn't focusing on how to have everybody be baby-friendly all the time. But there's a lot more support than just the hospital that's important.
Yeah.
And I think they've talked about this in focus groups.
I'd be curious the difference between large communities where I am in Silver City and Grant County. We're pretty small. All of the towns in Grant County are pretty small, and I think it'd be interesting to compare how maybe easy the information is disseminated and support happens maybe quicker because we're connected a little bit faster. There's only one hospital. We all know the providers. It has felt anyway working there for the last 21 years that it's different than being in a big city.
Right.
Yeah.
Right. So
I don't know how the populations that you were addressing might have felt. It would have been interesting.
Well, we know that in Las Cruces, a lot of the women said that they felt going to the store, or they wanted to do it because they were encouraged by their providers or their family members, but when they did, they were scolded, or they were, like they said, go to the restroom, and I'm gonna quote her, but she said, well, you go eat a banana in the restroom and see how that feels. So she was very assertive, and she said, you know what? She knew that was not a proper, but not everybody will do that. So
it's actually illegal. That law is 20 years old. That protects women for breastfeeding in public.
Right.
I just want to do a quick time check. We've got about 10 minutes
Yes,
left.
and I think we're coming.
Okay.
Thank you.
Yes, you're welcome.
And we also wanted to increase community awareness of the law supporting breastfeeding, including on the workplace, making sure that we, work more on that. They really wanted for our group to go and advocate for them and say, look, we are protected, we have some rights, but they felt like it can be retaliation from, so that was very difficult. On non-tribal lands, work to enforce statewide breastfeeding-friendly workplace law, especially for workplaces that employ Spanish-speaking Hispanics, and I think that's the same. Educate employers about the law and the importance of providing flexible breaks. And then on tribal lands, work with employers to provide space that is not a bathroom for women that are breastfeeding. So obviously we saw that there was a lot of support there, but they were still trying to find places where they feel comfortable. So, yes.
There's a comment on here. Adrian, can you read that?
Let's see. Where did I leave off? Okay, Walmart is not baby friendly, but the McDonald's in Walmart is.
Oh, nice. That is good to hear. That is good. So, but I think what we found is that, you know, we saw it was great to hear their point of view and also their needs and worries and barriers that they have and that they have, because they not often feel the support that they need when they can hear different messages from providers, midwife, but they don't. That reality is very different. And so, any other questions or anything? Any comments?
No, I think this is great, and I think but just hearing the voice of the communities, I know that there's been a lot of work with some other populations in terms of barriers and facilitators to breastfeeding, particularly with African American moms, and there's not a whole lot in the literature, especially for Native Americans, and how providers can support those groups. So I think this is fantastic.
Are you going to?
Are you going to do focus group on English-speaking Hispanics?
That depends. We never.
Yeah, I mean,
maybe there's a possibility that we can see that, and then we can also probably see the differences between Spanish speakers and Hispanics. And we know that there is a difference because of our culture and the assimilation and acculturation.
And I know as part of our workplace program, we're looking to work with Nuestra Salud next year on doing specifically some evaluation around the workplace piece of this, and there's definitely potential for that next year.
Great. All right, well, if there are no more questions, Maria, thank you so much for that wonderful presentation, very insightful. And Kevin, do you have any wrap-up items?
No, just if anybody hasn't checked in, go ahead and type into the chat box and let us know that you're there, and I'll save that, and we'll have our list.
Great.
Thank you, everyone.
Lots
I know
of
that
thanks.
I wanted to cover as much as possible, but it's we only had 1 hour.
Yes.
We have like 4 minutes.
It's a continuing conversation, for sure.
Definitely.
Thank you to all three of you. That's great body of work.
Yes.